Hi, everybody. Welcome to the podcast Redesigning Normal. I'm your host, Andrew Southern. And today I'm joined by Awstin Gregg, who's the CEO of Connections Wellness Group. Good morning.
Hey, good morning, Andrew. Thanks for having me.
Awesome. Thanks for being on. Awstin, can you tell our audience a little bit about Connections and about how you started it?
Absolutely. We started Connections Wellness Group about 2.5 years ago. And I was a former hospital administrator, CEO of a psychiatric hospital, and found an opportunity in the market to do things, in my opinion, a little bit differently. And so, instead of being one of the people who just talks about it or perhaps even complains from time to time about it, we did set off to create Connections Wellness Group. And the idea behind it was to create an organization that was encompassing healthcare. So anything from the common cold to allergies, all the way through the mental health spectrum of depression, anxiety, suicidal ideation. The idea was one phone call and we could treat it all. And we've had a tremendous journey the past 2.5 years, which led to phenomenal partnership and teaming up with Vertava Health. And we're just having a lot of fun and we're changing a lot of lives in the method.
Is this a model that folks have used in other areas of the country, or is this a novel thing that you've put together here?
I think there is some originality to it. A lot of times these are parsed in niches, and sometimes to see a specialist, you might have to drive 30 miles one way, and to see another member of your treatment team 30 miles the other.
Sure.
But in here, in the truest sense, you just walk down the hall.
Amazing, because everything's in the same facility.
Everything. Yep.
And just for the audience, where are you located?
We're currently located in Denton, Texas.
Okay. And some plans to expand?
Indeed, plans to expand. We've had luck over the past 2.5 years of expanding our footprint here in Denton to about 40,000 square feet and over 100 employees. And in the next 9 to 12 months, we intend to have 7 to 9 additional locations in DFW. We're really excited about that.
So in 2.5 years, you grew this to 100 employees, and now in another year, you're going to grow another 7 or 8 locations.
That is indeed the plan.
That's amazing. That's amazing. This is a podcast about the response to COVID-19, but I have to ask you this question. Mm-hmm. I keep seeing these apps that allow people to connect with mental health professionals sort of directly. How do you feel about that?
I think that is one thing that will survive the pandemic.
Huh.
I think what it does is it creates accessibility where it wasn't before. And so, previously somebody'd have to take a whole day off of work to go see their psychiatrist or therapist or doctor. Okay. But now you just run out to your car, hop on your phone and receive, very similar treatment, have similar outcomes, and then go back into work. And there's very minimal lifestyle disruption in this.
So I sort of thought of it as, certainly we see a lot about telehealth now, right? COVID sort of blew up telehealth. But mental health, particularly like talk therapy, is really well delivered via that medium, right? Mm-hmm. If the gold standard is sitting in person with somebody and communicating, only one notch lower would be connecting, on your phone through a high definition video app and having that time to talk.
Yes. And I agree with that. I'm a therapist at heart. That was my first master's. And there's some energy that comes through the room where you're connecting with that individual. Mm. And I won't disagree with that, but maybe an unintended discovery of telehealth was the ability to connect and the benefits of that. And so I'll just share, one in general. For someone who has high anxiety, it might be pretty tough to drive to the doctor's office, go in there, be sitting in the room. But in telehealth, if it gets too overwhelming, you just flip your camera off.
Okay.
Or you just exit the session altogether. And while it's rare, having that capability actually makes people open up a little bit more.
Amazing. Do you have that as part of your practice? Do you have a telehealth component?
We indeed do have a telehealth component. We're all over the state of Texas currently, and have had success expanding nationally as well.
Awesome. All right, I guess we should probably we'll feather back into that. So let me go back in time a little bit to early 2020. When did COVID kind of get on your radar that this might be something that affected you and your facility?
That's a great question. We saw kind of the ramping up of the epidemiology. We saw the infection rates going up, and even some states having, restrictions, whether it be stay-at-home orders or these mask orders. And we kind of suspected as these infections escalated that the state of Texas might do
Mhm.
the same. And in fact, it did. And so we're thankful that we had a leadership team prepared to do the telehealth model and that delivery. And it's something we have been doing, prior to the
Sure.
pandemic. Probably 5% of our patients were telehealth prior. And so we had some level of runway. And whenever the orders came home, the stay-at-home orders happened, people's anxiety and depression was through the roof. They needed us more
Right.
than ever. And I was thankful to say that we were able to flip to the telehealth model 100% overnight because of that prep that we did. And for the longest part, over a year, that's exactly the space we've been in.
So, what did the actual facility stay shut for a while, or were you able to reopen it at some point once Texas, I guess, got looser?
Yeah, we reopened it in
Okay.
portions. So our private practice medication management, that still majoritively is
Okay.
telehealth. We have some advanced levels of care for partial hospitalization, intensive outpatient. And because that just has such a complex treatment dynamic, that was the first service that we brought back in-house. And we had an infection control nurse, very stringent policies, and we're proud of our ability to mitigate those infections and keep people safe while treating their mental health. And so that's kind of how we
Right.
did it. And currently we're looking probably within the next quarter, Q3 of 2021, to begin bringing everybody back in-house that are of course
Got
comfortable
it.
with it.
Yeah. So actually, a lot of my discussions end up in this territory where it's like, okay, what did you do when you first started, and how do you make people feel comfortable coming back in person? Do you do temperature checks? Do you do air filtrate? Like, what do you do in your facility to make people feel comfortable and to make it safer?
Absolutely. So you're right. We have temperature checks. We have, N95
Right.
masks everywhere for those who want to use it. We have very transparent cleaning policies. We have hospital grade infection cleaners. You can just
Right.
smell it. And I'm not sure where you're currently at, Andrew, in terms of state, but chances are if you go outside and you probably smell the cleaning product from Denton, Texas. So that's how much we use just to ensure people are safe.
Yeah, but and that's important for two reasons. That first of all, I think it seems as though there's more focus now, rightfully so, on spaces being
Mhm.
clean, right? People are aware of this, right? But the other part is that
Right.
we have to coax the most skittish folks back into the world.
Indeed.
There's always going to be
Hmm.
a group of folks that, didn't ever really get too scared by the whole thing, and they they're out. And then
Hmm.
there's people in the middle who wore masks when they needed to, and then they were told they didn't have to. They just abide by the whatever the recommendations are. And then there's folks who are particularly skittish, is the term I like to use, and that's fine. They just had a different experience, and those are the folks, and they make up a good portion of the population that need to feel extra comfortable coming back out into the world.
Indeed.
And
So
maybe that's more of
yeah,
your profile, actually, right? Your customer profile.
we do have a lot of the anxious folks, and that's fine. Those early adopters and that
Mm-hmm.
bell curve that you're kind of explaining, wherever they're at, we
Sure.
can meet them. And so if they need a few more months to allow the population to go out and say like, hey, it actually
Right.
might be safe out
Got
there,
it.
that's fine. And then telehealth is certainly an option.
How do people find you? How do people find connections?
We have multiple places. I'd say, we work really closely with the community programs here. We have hospitals that
Okay.
refer to us, other doctors' offices, but the majority of our clientele is, direct to the consumers. We're proud of many of the awards that we've won for the care that we provided, and a simple internet search, typically renders us as a result. And people who take that first phone call, we're typically able to capture and let them know that, and quite literally, we have a
Okay.
specialist for them. There is hope, and there's one more step to take.
Interesting. Yeah. I mean, I think that whenever I've sort of been seeking that sort of help or someone to speak with, it's generally a person to person referral to an individual. right? But I
Yes.
like medicine that has a more like sort of standard, like you can go to a practice and they can get you to the right person. We've got all these, we've got this facility, we've got
Right.
all of this that we can help you with. Like I go in New York City, I go
Mm.
to a doctor's office, which is huge. It's like a huge, it's almost like a hospital, but it's a private practice, and they have everything. It's like on Tuesday they've got the
Mhm.
eye doctor, and they've got the sports medicine. It's like everything's there.
Mhm.
That some people really like that kind of delivery, right? Some folks still want to do the much more sort of, I guess, person to person referral, but I prefer it as a big facility, sort of, because I feel like there's more resources there.
Yeah, definitely more resources, and it makes every treatment plan
Sure.
really eclectic. We can come from a nursing angle, a clinical angle, a physician angle, an internal
Wow.
medicine angle, all for that one person. So all needs are met.
Incredible. And then how do you coordinate between between like the mental health and the sort of physical medical health? Like, is there a single caseworker for people, or like how does that work?
Yeah, you're typically assigned a
Okay.
designated treatment team, so they know exactly who they're working with. And we think, the medical component is so important for the mental health component. They tie in so well together. An example, small
Hmm.
one is the thyroid. If your thyroid levels are off, we could do all of the CBT in the world. But without fixing the thyroid, we're going to kind of be spinning our
Got it.
wheels a little bit. So to be able to approach it from a medical standpoint and then couple it with the mental health, we're seeing our
That's
outcomes be really
fantastic.
great.
And if you get to a situation, if your professionals get to a situation where it's a medical situation or something that is not covered inside the Connections Wellness Group, then you can kick them to whatever, you can refer them to the hospitals that you partner with, or the other. Is that
And
right?
that's exactly correct. And we have two, three local hospitals that all of our physicians have
Mm-hmm.
medical staff appointments there. So in the truest sense, if there's something that we can't handle, we can refer them to a hospital, and their doctor that they're comfortable with can go see them in that hospital. So they're
Amazing.
never
This is an
left alone.
amazing model. Um, how do people pay you? Do they pay directly? Does their insurance pay? Like, how does that work?
Yeah, it's both. We have both private pay and insurance models. We're a network with just about any insurance that you can think of. And so we really do our best to mitigate finances as a barrier. Even for the more advanced levels of service, we have partnered with a creative third party that allows for the financing of the treatment if cost is prohibitive. In a literal sense, it allows it to be interest free over 5 years. And it's something as
Right.
an organization we've worked out with them. But now the ability to receive life changing treatment costs like $13 a month. I mean, it becomes so
Mm-hmm.
reasonable, and it's something we're proud of.
Amazing. All right. So going back to the sort of COVID discussion a
Mhm.
little bit, you had initially, I guess, shut the facility and moved to telehealth with all of your patients and um, with all your
That is
professionals.
correct.
At what point over the summer you said you sort of were able to reopen parts of that
Yeah,
practice?
portions of it. And so some of the administrative
Okay.
support staff we were able to bring back in. We still didn't
Right.
invite the general community in because that was just a variable that we couldn't control in terms of infection, but we were able to kind of control the staff's level of exposure there. So we started with the administrative staff,
Sure.
and what we found in terms of the growth and the COVID and how we pivoted, it was definitely needed.
Got it. And then when did you get to the point where you has it been gradually reopening? Like, where are you at right now?
Yeah, where we're at right now is we probably invite less than 100 clients per week to come into the facility. And, we're really
Okay.
testing our controls to make sure we're doing it safely. There's nothing we're missing. And right now, all of our KPIs
Sure.
are suggesting that it's going to be okay. And so it's a gradual titration
Right.
there.
Yeah. Just play it
Hmm.
slow, because people are still getting the care that they need via
Indeed.
telehealth. I'm interested, actually. How do people in general respond to getting mental health treatment, for instance, via telehealth? Like, what's the feedback from the patient? Is it would imagine it's overall positive, but I'm interested to know.
It is overall positive. The convenience factor, we're showing that our no-shows or missed appointments are going down. People are attending their
Right.
appointments, and when that happens, the outcomes go up. And so we're a really data-driven organization. We care a lot about our satisfaction, clinical outcomes. And the way that we've been
Okay.
able to manage COVID, we're actually seeing both of those metrics go up in this new virtual care setting.
So with your leadership hat on,
Sure.
having learned what you learned during COVID, particularly about telehealth, is there a magic number somewhere of in person versus telehealth? Because you can grow
Mhm.
with telehealth, right? I think you mentioned maybe even growing outside of Texas.
Yes. Yeah.
So what's the magic ratio?
I mean, that magic ratio might be something we're continually defining for ourselves.
Yeah,
Um, you know,
sure.
I think it really is going to lend to the preference of the patient because, we say as mental health and medical professionals that we'll meet you where you're at. And
Hmm.
depending on if you are at your home and that's where you want to be met, then, that's our obligation to meet you there, stand by those words. So it's an ever
Sure.
moving variable in inference on that one.
Got it. And what are the hurdles for providing care out of state? Like, are there actual regulatory things for telehealth across state lines?
Yeah, there are. And so all 50 states have their nuances. And so that's an onus of
Okay,
leadership just to kind of understand those, how you
sure,
employ physicians and therapists in the different states and where the clients have to be located. But it's very doable. And once you know kind of the system, you're able to implement
hmm
the strategy behind it.
if you were connecting someone in New Jersey to a professional therapist who's also located in New Jersey, I imagine that's probably the easiest version versus connecting someone from New Jersey to a professional that's in
Mhm.
Texas. Like that is that cross state, that internet cross state lines becomes an issue.
It does become an issue, and really it depends on where the clinician provider is licensed. One of the things from the pandemic and COVID, some of the reciprocity requirements were lessened to ensure that people are able to be given care. But that's one of the
Okay,
things that I kind of see going away, and in a bit
sure.
it is going away. But there's still an ability to extend someone's license to a different state, provided that they're comfortable. That way you do have that reach and expansion.
Got it. I think you're going to need an app if you don't already
Yeah.
have one.
One of these days, it'd be nice to have our own app. We partner with a third party right now who does do a pretty good job at allowing people to connect and giving the right reminders and resources. But perhaps one day we'll
Sure.
have our own.
Yeah, like a patient portal, and then you can connect right inside the app.
Yes, yes, yes.
Um, that would be kind of like the best of both worlds, I suppose. Because I guess, like, I really like the idea that you have a facility. It's in normal times open to the public.
Mhm.
You can go there. You also have this telehealth portion. That's a different model than the sort of strictly app-based solutions we talked about earlier.
Right, right.
More like grounded. I don't know. I feel like that would be more comfortable for some folks.
I would agree. Definitely a business model there. Yeah, my brain turning now.
Okay, so yeah, I wanted to just kind of like mine into the COVID stuff a little bit. Beyond telehealth, was there any other items that you feel as though lessons learned during the sort of height of this once every 100-year pandemic that
Yeah.
you can use moving forward?
Well, I'd offer an approach of what we did for our employees. And
Yes. Okay.
one of the most common things people say is, your work-life balance, your work-life harmony, like take care of yourself. And I feel like perhaps it just kind of stops there for some organizations. But we found a way to take it one step further. And what we found was, our employees were struggling with the same type of anticipatory anxieties,
Hmm.
curiosities. There is this invisible thing everywhere that could possibly in my life for the ones that I care about. And that's kind of a terrifying thing. And then you couple on, businesses that are struggling in the community. Will I have a job? Will I be able to provide for my family? Like, that's a lot. And,
Sure.
it really requires our clinicians to take care of themselves to our greatest rivals, our burnout and compassion fatigue. So
Okay.
we created this wellness program that quite literally said, if you leave work on time and you go home and you do something healthy, whether that's exercising, cooking a healthy meal, reading a book, continuing education, whatever self-care is to you, we will actually pay you a second source
Hmm.
of income to ensure that you're taking care of yourself. And it was just the coolest phenomenon because we had employees that were posting their self-care, which was encouraging other employees to do their self-care. That created a community that people who might not have ordinary talk to each other now know, like, hey, we have the same type of hobbies. It
Hmm.
enriched our culture, and I think that's something that will absolutely stay. And it's been something incredible to minimize, if not eliminate, our turnover during this tough time.
Where you actually encourage folks to do that balance with money, right?
Yeah.
And that like that's the ultimate one of the ultimate motivators. But it's true, and it's like
Hmm.
if this is what it's going to take to get everybody healthy, your team being healthy is worth that money and then some.
Absolutely. Oh, absolutely.
That is awesome. That is awesome. I've had a number of conversations with different business leaders, and this idea of this has been a hardening a team. I should say a team building slash hardening time, right? So
Absolutely.
teams that maybe weren't even as strong before COVID got strong,
I
right? And
agree.
teams that were already strong got stronger. And I haven't spoken to anyone where teams, kind of blew apart. I'm sure that that's happened, but I haven't spoken to anyone like that where they just struggled to keep everyone together
Right.
across all kinds of things from hospitality to education. We talk about the employees and the team coming together and rallying during a really difficult time. You can imagine, a year from now, hopefully things are way easier. Like just like way easier. We could just do the job that we were going to do. Remember back then when we had to do our job and also manage the pandemic?
Mm.
So I think
Yeah,
that's that light at the end of the tunnel. It's like we went through it, and the organization went through this, and we did okay, and now we're coming out of it, and we can just do the job we were supposed to do.
correct. We have something to bond together because we did make it through a tough time.
A lot of folks are having a hard time finding people to work with them, right? To
Mm.
like staffing. Are you
Yeah.
having that problem as well?
You know, thankfully, I don't think that's a problem that we're having.
Great.
We ensure that taking care of our employees and our clients is always the tip of the arrow for us. And during COVID, we actually had one of our greatest stretches of growth. And to be honest, we are seeing an increase of a need for additional clients or additional clinicians.
Hmm.
And so we went to post the position and we said, like, well, if they're all virtual, what would happen if we just opened the position to the entire state? Like,
Right.
what would happen? And so we did that, and we received 125 applications in an hour.
Amazing.
And so it really, like, there might be something here. And so we did that. We created a successful strategy to ensure that we could retain that type of number. And then we said, what if we did it in another state? And what if, and these what ifs turned into growth. It turned into great clinical outcomes. It turned into us being able to take care of our employees better. And so
Amazing.
we amalgamate all these variables into exactly where we are today.
What's your thought as a leader on sort of runaway growth? What you're describing is incredible, right?
Mhm.
Do you need to temper that in order to not like blow it out too quickly, or are you just going like full bore every day to grow?
Yes, if you could see the whiteboard in our conference room, there are three things that I say, hey, if we expand and we dilute these three KPIs, it is a hard stop, immediately pull the emergency brake. And that's our outcomes, our satisfaction, and our employee turnover.
Okay.
The very second one of these becomes off, then we have lost our poise in the market. And so we're thinking and talking about that every single day. And I think because it has that proper attention,
Mhm.
that we are able to sustain growth in this way.
That's amazing. Right. So you're monitoring those very heavily, like daily
Hmm.
or weekly.
Oh, yeah.
And if
They're
you
the
see
most
a
important
dip,
things.
if there's a red light that starts flashing because you can't
Hmm.
grow um, if those are going to be left behind or if you're going to like sag in any of those categories.
Absolutely. Absolutely.
And so you wouldn't be afraid to like pull the, like pull back on the reins if you needed to in order to maintain those metrics.
Absolutely. And I
That's
think the
cool.
rest of my team knows that they too can pull the reins. There is no point in growing
Uh-huh.
if we are not having good clinical outcomes.
Okay.
There's no point at all. And there's no point in growing if we're just having a clinician and provider carousel. Neither
Okay.
one of those things are attractive. And so, yes, at the minute that happens, then we would stop. Um, but again, I think because we have that focus so intensely every day
Yeah.
is the reason we've been able to sustain it.
Just very much in the weeds because I'm interested in the
Sure.
KPI discussion. How do you qualify success in the mental health world?
Absolutely.
Is it that the client no longer comes to you? Like, is it that you've finished the course of care, or like how do you measure that?
Absolutely. Well, that's the ultimate goal. If we're doing our job right, we should be
Okay,
working ourselves out of a job. But the way that we
cool.
quantify is we use both qualitative and quantitative measures. The quantitative being the easier. We assess the level of severity of the symptoms on day one, and then we
Hmm.
assess it mid-treatment and at the end of treatment. And we like to see that change score go down pretty significantly. And we take that rate of change, just for easy numbers. Say someone comes in at 100, and then they discharge at 25. So we've
Hmm.
decreased it by 75. We compare our outcome measures to the national averages and we see how are we doing compared to other treatment services available. And quite commonly, we're finding that we are 2 to 2.5 standard deviations above the national averages in terms of outcomes. So that puts us in a classification that we're very proud to be in, one that we want to stay. And that's how we quantify the patient's journey.
Okay, got it. So I didn't realize that that was a published metric that you can actually compare yourself against. If it was, as you put, like a scale of 100 to zero
Absolutely.
pain, or wow.
Yeah, so we're definitely excited about that. It's something that we'll wear on our sleeve, and that's why we come to work.
Okay,
Good business is solving a crucial social need, and helping people live easier, helping them live a better life, and everything else follows that. To include the business function of finances, but the
hmm,
the emphasis must be the service that you render, and if that becomes of less value, then the entire organization then defaults into the same, and so it's always
got it.
top of mind for us.
What did you see in your previous role? And you were working in a hospital, right?
Yes,
Or you were CEO of a hospital?
yes,
You Whatever you saw there caused you to create this model instead.
yeah.
Was it inefficiency, or was it like what was it?
It was, a combination of things. But I would say that you have visibility to your recidivism, people that you have successfully treated, but for one reason or another, they come back. And the
Hmm.
reason they come back is a lot of times due to discharge planning. It was that phenomenon. Well, you need a great therapist, you need a great psychiatrist, you need great primary care. But they're all 30 miles apart. They all have a 2.5
Right.
week wait list, and I don't know if they're going to cancel on you. And so people are returning to the hospital because of this. And so, as an entrepreneur, across my mind is like, what if there was one location that had it all? And those
Hmm.
staff were enriched, they're happy, they are fulfilled, we render good clinical outcomes. And that what if was enough to begin the company. And I think that's exactly what we've seen is, it's all in house. And our patients, hardly ever have to go to the hospital. And they get better every single day that they come. And so there's this
Right.
great fulfillment methodology there. And, that was a curiosity that piqued the ability to open the own business.
Amazing. Because sometimes the barrier to care is something like a long drive, or the logistics of getting from one place to another place. I mean, you can see this, and actually, now that you're saying it, that drive time problem is a real problem for all kinds of things, from voting to vaccine
Mhm.
distribution, right? It's like,
Yeah.
sure, like you and I would get in our car and go somewhere, but en masse, a huge group of people, that for some portion of the population is it's just too much hassle, or the car's broken or whatever,
Hmm.
right? So to have a single point of care in a single facility is amazing. And you
Absolutely.
wouldn't have known that if you hadn't been in that role before and seen people coming back to the hospital because of that particular problem.
Absolutely. It was great visibility. See it,
Huh.
and like you said, you have the drive time and you have the cost of gas. And if you have kids,
Right.
it's childcare. If it's a job, it's having to ask your boss again
Right.
to leave. And at some point, it's not worth the squeeze anymore. And it says, maybe I can endure and persevere these symptoms a little bit longer. That way, I don't have to worry about these
Mhm.
inefficiencies. And what ends up happening is, the worst case, and you have to return to the hospital. And so having something local, having something accessible, I think takes away all those
Wow.
barriers.
It's like it's not efficient. It's efficient and convenient, but that's a
Yeah.
byproduct of the of what you're trying to do, right? Because a lot of people try and optimize things to make it more convenient for the customer.
Hmm.
This is integral to the care program. This convenience.
Yes, I agree.
Cool.
Convenience, efficient, and it's not cost prohibitive either. It's very affordable.
Wow. Amazing. This is an amazing. You see that I've gotten like really into this model now. I think it's brilliant. Also, I think it's a brilliant concept, and I'm so excited that the audience that's listening right now gets to hear about this.
Likewise.
Now, what can folks do? I guess certainly they'll be able to find you right from the podcast. If so, folks are out of state and they were looking for some help that you provide, would they be able to sign up with you?
Absolutely. And so we're growing our national footprint. We recently partnered and teamed up with Vertava Health, which is
Vertava.
a fantastic organization. Um, and with that partnership, we've been able to accelerate our ability to deliver care. And our virtual care platform is expanding through the United States. And, eventually we intend to be in all 50 states. And so for any person who might be listening, it is quite simply just one Google search away to living a life that's a little bit lighter.
Awesome. With that, Austin, I think we're good to wrap up. Thank you so much for your time.
Absolutely, Andrew. Thanks for having
I
me.
really appreciate it. Have a great day.
You too, sir.